You try and get back to normal. It's a new normal. During treatment you get exposed to various side effects, and sadly for me those side effects continued. I had bleeding of my bladder. I still have chronic diarrhea. I have had lots of different investigations from different doctors, so I now have a whole series of doctors around the city who try and help me. I've also had hyperbaric oxygen treatment to help with the diarrhea and bleeding, of which it's great, but it's started to slip off a bit now, so that's why I'm going back for a top-up in a couple of months to try and help that. But I know where every single public toilet is around the city, because it's not a nice thing to have to deal with, and with that comes the pain. I have adhesions in my pelvic area, my bones are sore, so I have to deal with a lot of pain. But it's worth it, and they obviously gave me a high dose of radiotherapy, and given my time again I would have exactly the same treatment. It got rid of the cancer, and if it killed a few of my cells in those areas, who cares? I'm here and I can cope with it.
She had to have a stoma for the first 12 months, which just wasn't pleasant for her, and I think so a stoma is like a bag that catches fluid and things. Sticks out of the body, and you have to wear baggy clothes, and the thing leaks a bit, and you've got to change it, and it's just not very pleasant. So she had that for 12 months or more.
Women, for example, who has had pelvic radiotherapy, which is common treatment for cervical and endometrial cancers, may experience a lot of problems with the bowel, such that they're having frequent diarrhoea, such that they may not be able to work in their job as they normally would, because they may be going to the toilet with little warning 9 or 10 times a day. But these are things that people feel that they shouldn't mention because they are what they should just put up with, and that's one of the really important things, that we hear stories, but we have to get women telling us these stories more. Women who've had surgery for ovarian cancer may often find that instead of their bowels being loose, they are more prone to constipation. And for those women, simple strategies may help, making sure they've got sufficient fibre in their diet, making sure that they drink plenty of fluid, get plenty of exercise, but also that they use laxatives as required to help with that problem. Women following premature menopause in particular, but also following radiotherapy, may find that they get urinary urgency and even some minor incontinence, whereby they get very limited warning of needing to go to the toilet. For those women, referral to somebody who specialises in pelvic floor physiotherapy or a continence specialist is a very important way for them to go. Equally, these women may try not to drink things because they become dehydrated, and this makes things worse, feeling that if they don't drink things they won't need to go to the toilet. It's still important that they do drink appropriate amounts of fluid.
Many women experience quite long-standing, sometimes permanent disruption to their bladder and or bowel function. This again is particularly prevalent in women who've had radiation treatment to their pelvis, but also women who've had their bowel shortened by surgery, and particularly women who've had a colostomy as a result of their surgery, usually for ovarian cancer. So although that's a medical issue that requires quite expert intervention and a lot of assistance from people like continence nurses and stomal therapists, in terms of the social implications of bladder and bowel disturbance, it's really significant. I remember a young woman who, out of all of the things that had happened to her with her cancer diagnosis in her 20s, ovarian cancer diagnosis in her 20s, for her the worst thing was the colostomy. And she said to me, "I'll never be able to go to the movies again," because she had a sense that she couldn't ever be sitting in a quiet place with this unpredictable thing that might embarrass her with its noises and unusual behaviours. So it is quite limiting for women in terms of their ability to work, to manage children, to have to cope in social circumstances, and a very big impact on their body image. So women who have visible ostomies, goes without saying that really changes the way that their body image is. But women who also have to wear continence pads, who have to quite significantly change the way that they dress or what their social activities are to accommodate a need for frequent use of toilets find it quite disabling and a real impediment to all the challenges that are already there in terms of getting back to being a normal human being once your cancer treatment's finished. Women who have ongoing trouble with their bladder and bowel dysfunction are often reluctant to raise that with their clinicians. They feel that, oh well, it's a part of the treatment and I should feel lucky that I've survived the cancer, and what can they do about it anyway? That reassurance, normalisation, validation that this is a really common problem after treatment for gynecological cancer. And so if I know someone who has a colostomy or who's had radiotherapy, even though I am the social worker and not their doctor, it is okay to say to them something like, and how are you finding your bladder and bowel are working at the moment? Is that an issue for you? And they might say, well, yes it is, but I haven't sort of talked about it to anyone because what can they do anyway? Oh, we have a stomal therapist here and maybe that's someone you can see. Or have you talked with the continence nurses? Or if appliances and liners and pads and things aren't working well for you, let's talk and see whether there's something more up to date and better for someone in your situation. So it is about giving permission and giving information and encouraging them that they're not the only woman who's going to have had this issue after their treatment.